So, Jaya, what was it like making that transition from doctor to patient?
In one word, difficult. I felt vulnerable. The dynamic of decision making had changed. I still find it difficult. I lost my sense of, a sense of control and a sense of locus of control, shall we say. And also how I felt less empowered for some reason, certainly initially. I was at the other end, and I should tell you, I was and remain a terrible patient and a demanding patient. Imagine Woody Allen, but worse, and with a medical degree. This, coupled with my anxiety, naturally catastrophizing predisposition, did not help. Being a doctor does not always help. You just know a little bit too much. I wanted to know results ASAP, often unreasonably. Asked many questions. I probably generated more tests for the poor docs and nurses because of my anxiety. I questioned some decisions when they were totally right. And for example, should I have a change of antibiotics? For those sort of things. Some of the drugs, such as dexamethasone, which is a steroid, heighten the above. And you can imagine that in an almost manic state, all the above qualities were exaggerated. What an even additional nightmare to manage. But the teams and staff, I have to say, were excellent and professional, sensitive, kind, caring, compassionate, always had time for me, and really adapted to treating a challenging patient and colleague with a challenging disease. They've done everything up and beyond for me, and I have to say I've had the best care with the haematology units. I have complete trust of them, complete trust. They always gave me time and did not make me feel I was the pain in the backside that I must have been. We laughed and cried together. They held my hand and tolerated my hugs when I must have sometimes indeed stepped into their personal space. Some doctors aren't huggy people, but they just tolerated me enveloping them. Anyway, having said all that, as a patient, you are the expert of your disease. You don't think something is right, trust your gut. Persist, persist, persist. Ask to be reassessed and reassessed. And that's important. And ultimately, it's you with the staff working as a team. It's not a competition, it's not them and us, it's us together. I'm immensely grateful to my teams for giving me the chance of survival this far and continue to try to give me more survival time, which what will turn out to be an incurable disease. The NHS is full of excellent doctors, but I just want to single out my haematologist, Beth Harrison, Sridhar Chiganti and Charlie Craddock as exceptional doctors, and their teams. You are amazing people, and I am lucky and privileged to have been your patient. I just wanted to add another very important thing. I'm humbled and learn a lot from my fellow haematology patients who are also on similar journeys. Not to mention the camaraderie that we also shared. Their dignity, stoicism and resilience was truly inspiring to me.